I'm also going to talk briefly about the Asilomar Accords because I do really strongly recommend using them in terms of creating a common language for your shelter and your community in terms of data keeping and in terms of knowing that your shelter has a general policy for whether a dog with severe food aggression is treatable, manageable, treatable, rehabilitatable, where it falls into things in your community. Always remembering that our problems are classified according to what a reasonable and caring pet owner would do and not according to the resources that I have within my shelter. So I may be absolutely overwhelmed with problem dogs in my shelter, which I often am because people try to send them to us, and I don't have the capacity to take one more problem animal right now. But I'm still going to classify that pet according to what a reasonable pet owner would do and not according to what I can do right now. Does that make sense to everybody? So just an example of using the Asilomar Accords to classify behavior in shelters. This is a matrix that I made up myself, not based on any research at all, just an example. I would consider a healthy pet a pet with no behavior problems at all. Treatable, rehabilitatable problems. Most behavior problems are going to fall into the treatable, manageable category because most behavior problems need some type of management to prevent them from recurring. So as an example, even incomplete house training, if they don't manage it by taking that pet out as often as it needs to go outside, that pet's going to have a problem again. So most behavior problems require some management. But I do have some, such as attention-seeking behaviors, that fall into the rehabilitatable category. And we do know that if our adopters are consistent about following our instructions, that the problem won't recur. And for me, with the unhealthy, untreatable category, I have lots of caveats there to what falls into unhealthy and untreatable. So you can see dogs' aggression to dogs, cats, or people, which has resulted in severe injury to people and cannot be successfully managed despite skilled management and training. So as an example, if I have a dog in my shelter that has a history of fear aggression towards strangers, there is a decent chance that we are going to take that dog into the shelter, work with that dog, and see how he responds to management and treatment. We might even send him to a foster home, which I love to do, to see how he does there. If despite us doing everything that we can, this pet still has a very serious problem, and I feel that he's a serious risk to the potential new home and to the people who work in our shelter, that pet is then going to be moved into the unhealthy and untreatable category. So for me, oftentimes it doesn't fall into that unhealthy and untreatable category for behavior until I know that I've managed this pet appropriately and done everything I can to try to help it. Similar to what a reasonable pet owner would hopefully do.